Just kick off. Hi everyone, I'm the founder of Metacarpal, and we're doing the first fully body powered bionic hand on the market. Prosthetics. For the last 50 years, prosthetic hands have basically been racing towards these robotic bionic hand solutions, but yet today the most widely used prosthetic hand is still a steel hook that was invented the same year the Titanic sank. And why is that? Because despite all of the tech, those robotic hands, they actually still offer less precise and less reliable control than those hooks. And that comes with a much higher price, as well as being much more fragile. So the hooks themselves, on here, they're practical devices, but they've only got a single grasp, and for many, the way they look is a complete non-starter, and it puts a major dent into their confidence, which is a big job of prosthetics. And it's led to many people feeling that prosthetics has really been developed without user needs at the forefront, and instead of being led by technology itself, creating a big disconnect that's led to low satisfaction and low adoption. Only about half of people with limb differences are even using prosthetic devices. And so that was why I started Metacarpal, as a mission to make upper limb prosthetics an indispensable asset to every amputee. And start with how we look to do that. So Metacarpal basically combines the best of both technologies. So we've got the first mechanically operated bionic hand. So it takes the way that the hooks are operated, so the really intuitive, reliable, and precise operation, and it combines that with all of the abilities that you'd associate with the bionic hands. But we achieve those purely mechanically through a series of mechanical engineering innovations. So what that looks like for users is basically they don't have to make any compromises across the things that they value most in their prosthetics. So the way that it looks, the function that it's giving, and the reliability in that being absolutely core to it, as well as just the robustness. Because we don't have 6, 7 separate tiny motors stuffed into the hand, we can make this thing much more robust, which is huge for users. In terms of the business model, we outsource the manufacture of parts to primarily in Scotland, and then we assemble them here at Metacarpal HQ in Edinburgh to ensure quality control. These products are then sold through a direct sales team. And for the first 12 to 18 months, we're focused entirely on the US, but our ambitions are global. And the products are sold to prosthetic clinics for around $16,000. The clinics themselves apply for reimbursement at around $55,000. So this ensures high margins for the clinic, and if you see on the bottom, high margins for Metacarpal as well, with profit margins around 80%. And this is really important for the clinicians, because at the moment they're fed up. When they fit a hook device, it's not profitable for them because the reimbursement is so low. And when they fit the myoelectric device, the training time is so high and the amount of repairs that come in that that almost makes it not worth it as well. But in comparison, Metacarpal requires 3 to 4 times less clinical time to train the user and drives in 5 times as much revenue as a hook would. And the device itself is much more robust, so they don't have to worry about it coming back. And in terms of the IP space, all of the industry has been focused on the myoelectric or robotic devices, and it's really congested market space, whereas Metacarpal stands completely alone in this new mechanical multi-articulating space, and we could build an IP fortress, which we've already begun. Our breakthrough has really been reactive grasp technology. Essentially, this replicates the abilities of the robotic hands to adapt their grasp around an object automatically. But we achieve that with pure mechanics. It's lighter, it's more robust and it's far more affordable. This has been patented in the UK and US and is still in its PCT currently. Our sales cycle is what we've been refining for the start of 2025, and we've validated that now. Basically, because Metacarpal is much easier to learn than comparable devices, we could do a trial, and within about 30 minutes, so far we found around half of users are outperforming their current prosthesis that they've been using for years, and that's in standardized tests. So basically what we do, we'll run one of these demo days with a series of users at once. We can then use the footage from these days to advertise ourselves, as well as letting the clinics use those footage to advertise more users into their clinics, driving more demo days for those clinics, and we'll acquire more clinics to run further demo days, creating that cycle. And every time we run a demo day, we qualify leads, and that's how we convert to sales. So I'll hand you over to Erica, who's our North American Sales Director, doing a fantastic job at running these demo days.
Perfect. Thanks, Virgil. Yeah, so I will jump right in. I think it's really fantastic to just see a glimpse of what's happening real time. I'm doing these very often, so let's go ahead and jump in here, Virgil, if you could advance. But these are side-by-side videos of real users. Here we have a 77-year-old male who had had a myoelectric hand for years and years, as Virgil had said. And in a matter of a minute, they're only able to transfer 2 blocks with their older prosthesis. And in a minute with metacarpal hand, 10 blocks. So we're seeing really great outcomes very quickly. In the next set of videos, here we have another gentleman who is a 38-year-old chemist. Again, same standardized testing, and with an older prosthesis that he's been using for a long time, he's able to transfer 3 blocks, and with metacarpal, 9 blocks. So we're seeing really great outcomes with these in a very short amount of time. And then in our last video here, we have Roy. You'll see his prosthesis looks a little bit different. It's going up there above the elbow. So again, expanding the reach of patients that we can get to. And with his body-powered hook that he's using, could transfer 4 blocks, and with his metacarpal hand, 13 blocks. So this is for me, the most rewarding part is being out there, seeing this real time in the field, and seeing patients really discover what they can try and what they're not afraid to try within a half an hour or 40 minutes of trying this device. So it's really everything here in these demo days that is filling our pipeline. So let's jump right in here and we'll kind of walk you through what is in the current pipeline right now and how we got there. So since my introduction to Metacarpal, I came in at the end of February, hitting the US market. We've had 13 leads moving through our pipeline, 2 groups interested in distribution beyond that, and we are projecting currently 4 hand sales projected for Q2. Moving along, how did we get here? This is exactly that cycle that Virgil discussed. We're doing patient demos in the clinics, looking to ramp this up. So I'm one person right now in the US, and the more people we can have on the ground, the more of these demo days that we can get, and we can impact the amount of leads going into our pipeline. So from these demos, we had 11 with 8 leads. That's leading to just under a 73% conversion rate of patients who are going to be good candidates to sell this to. So as we're ramping up these efforts, we've also, we've tracked these demo days. So with the 9 demo days that we've held, we are getting on average 1.7 leads per demo day. So if we are looking at the amount of demo days a single person can hold, we can really set a good benchmark moving forward to try to project the amount of leads going into our pipeline. And so what we project with what is currently in there is we'll have about 16 new patient leads in Q2. So because of this benchmark, as we look into Q3, we are looking at 12 demo days currently in Q3. And so with that same benchmark that we've already put in place, this should lead to about 20 new patient leads entering our pipeline. So in terms of the numbers, what this is looking like is, currently we're sitting at about 223,000 in our pipeline. this will get us to about 541,000 in our pipeline, using, again, that cycle of getting into the clinic, setting up these days, and getting this on the patients who they can really get the most value from this very quickly.
So thanks very much, Erica. There we go. So yeah, since Oxford Technology invested last year, we've really moved faster than ever. As mentioned, our team has been our greatest asset. Together, we've finalized our product development, created a supply chain, and now internationalized our IP, which has been a huge step forward. But the team that we've built has, and it's been surreal for me to have brought in such renowned industry figures. First, Hugh Gill has joined in as our CTO. He was CTO of Touch Bionics, which was the first ever bionic hand on the market. And then Erica, who joined most recently, is doing an exceptional job out in America as over 2 decades of experience in prosthetics sales. So really understands not just the US market, but international healthcare markets and how to navigate those intricate systems. Messed up these slides somehow, but so the upper limb prosthetics market is valued at around $1.5 million in total. So this year we're targeting around £600,000 in revenue. And in our first year, we want to grow substantially so that by 2027 we're targeting £4 million. So as you can see, over the 3 years projected there, our reliance on add-on product sales grows steadily as we build new exciting products into our pipeline and get some more key accounts as well. So at the moment we're raising investment for £400,000 with a £550,000 ceiling, and we're expecting to close this by June 2025. Had our first commitment now from Oxford Technology themselves of £91,000 already, and that's from the fund, and that's an EIS investment as well, and that's a pre-money valuation of £4.5 million. What we'll do with this investment, primarily we're spending it on sales and marketing and engineering as well. This enables us to buy the units that we will then go on to sell, but it also gives us more budget to give more support for that sales so that we can really maximize our potential out in the market and achieve those growth targets. In terms of product development, this means adding 2 key products to the ecosystem that add on value to our flagship device. And crucially, we've got evidence from our suppliers to say that if we can achieve 90% margins, so vastly improving profitability for Metacarpal going forwards, making it crucial. So why invest now full times? Well, over the last 12 months, we have massively de-risked the project. We've proven clinical demand through our demo days, we've proven user demand, and we've proven the technology. And we've done that with a team with a proven record of success in this industry. And so by investing right now, you're investing at a valuation that marks, I think, a 25% increase from the last time Oxford Technology invested. But with revenues and the pipeline building, we're on the cusp of rapid valuation growth. Now, our motto to all of our users for the company is grasp every moment. So I would encourage you guys to grasp this moment and invest in a company that has massive growth and impact potential. Thanks very much for listening. Forward to your questions.